Are you ready to get the Hydrafacial glow? Loved in 87 countries across the world. It's not a facial, it's a Hydrafacial. Now available across the UK. Visit hydrafacial.co.uk to find your nearest location.
Gorgeous. You look lovely and springy today, like a sort of little kangaroo.
Oh, thank you. Springy as in bouncy or springy as in the month?
Springy as in the month, it's spring again. Tulips from Amsterdam. Sorry.
Oh, please don't sing. Please don't.
Thank you. My name is Dorothea Delirious today. So don't forget to like and subscribe to us on YouTube.
And join us on Instagram at the.beautyangels, and don't forget to follow us and like everything we put on there, because there's loads of hints and tips on there daily, aren't there?
Tints and hips.
Tints and hips. Do you know Lucy's got into a habit in her brain where she can't stop doing that with everything everyone says?
Really?
Swapping letters round. Lucky she's not playing Friar Tuck.
Yes. Anyway, and those of you who didn't understand that joke should not watch this show anymore. Now, we are talking about our bodies today. Now, I did something the other day. See, I was going out and I was white as a sheet. I didn't have time to go and get a little spray tan. So I found this, and it's this Chanel stuff. Les Beige. Have you seen it? Le Beige or Les Beige? It's a cream. I don't think we've talked about this before. And I literally, I'll show you. I just went, oh no, what I'm going to do? I'm so white. I'm so white. So I did this, and I don't know if you can see it right now, but it's actually quite a nice colour.
Now, does that come off, if you had a white dress on, would that come off all over your dress?
I don't know, because I haven't got a white dress on, have I?
Yes, I know, but it's no good if it's going to come off on your clothes. And if you stay in a hotel...
I don't think it would.
Because it's quite in a lovely... Can I speak?
No.
If you stayed in a lovely hotel with your boyfriend and then your sheets are all that colour in the morning, it's not a good look, is it?
I'm not talking about the night with a man. I'm talking about taking yourself out to do. And
yeah, but that usually ends up with you spending the night with a man, doesn't it?
Who is Linda Lusardi? Why has she got this much? No, if I was spending the night with a man, no, I wouldn't even wear a fake tan. I wouldn't like to see lots of stains in the bed. And I meant from the fake tan.
I do remember, I have to tell you, I did a scene in the Bill with Murray, what's his name?
Billy Murray.
Billy Murray. And we, I did have a cream bra on, but like a sort of balcony bra. And I thought, well, I was so white, it was winter, so I did put fake tan on the night before, sprayed it all over. And I was so late in the morning, I didn't have time to really wash it off. So I thought, oh, well, I look great, it looks really brown. We were laying in bed, waiting for the scene, and I could see him going, because it just smelled like burnt flesh. It smelled disgusting. And I had to say, I'm really sorry, that's not anything in the bed, that's me. I stink like I'm burnt. It was really horrible. Anyway, we digress.
I've heard stories that Billy Murray says that Linda Lusardi smells like burnt toast, which isn't very nice, really.
No, it isn't. It isn't, but it was true. It was true. But I was very embarrassed, and I wish I'd had a shower in the morning, but anyway, I didn't have time.
I once did when I did a play with Omar Sharif, I've just to drop this one in, called The Sleeping Prince. We had a scene where I had to kiss him, and on the opening night of this play, he decided to put a coloured parmain on his moustache and in his hair.
What's parmain?
It's what you use. It's an old-fashioned thing that you use in your hair, that men used to use in their hair. So it makes it a bit like gel, I suppose, or wax. But anyway, he put it on his moustache. So we had this scene, and he had to kiss me. And then I pulled away from him. And for the rest of the scene, I had a moustache mark.
Oh, no. Did it throw him? Looking at you with
it threw him, but it didn't throw him. The audience loved it, of course.
Oh, how funny.
I just thought what I was doing was hilarious because it wasn't me.
You thought you were a brilliant comedy actress, and it was the moustache. So would you say that you are fairly confident in your own skin?
Yes. I would like to be slimmer, but I mean, who wouldn't? But I am fairly confident. And I think as an actress, you kind of have to be, really. I don't like it when I become overweight and have to sort of waddle around. But I mean, we have so many tricks, don't we? Of, you know, these wonderful sort of shape wear and lots of bits and pieces. So I can usually get away with it. But then you see bits of things hanging over the top. So I think we're going to have to watch our bodies. So that's why we need the treatments. We
do need the treatments, but I think I'm quite confident in my clothes but I find I'm covering up. Whereas I used to dress to expose everything, you know, I'd like a nice cleavage and my arms out, my legs out and everything. Now slowly I'm covering everything, you know, because my legs don't look good without tights. So I quite like a long dress, and I tend to have sleeves on now because you get the old dinner lady's arms a little bit. Still show the cleavage off, but not quite as much as I did before. So I am dressing to hide myself instead of trying to dress to expose myself when I was younger.
Yeah, I never really did, because I was never that. I was body confident, but not that much. Not like you, darling, because you're a different sort of person to me. You know, that's your job. That's who you were. But I felt, unless I was working, when I'm working, of course, it was always those sort of things. But in real life, not really. I think I'm a kind of jeans and t-shirt kind of a girl, really very well, you know that, very casual person. So only when I go out and tart myself up.
But don't you look back at yourself and think, because I was never satisfied with, you know, I don't think any woman ever is satisfied 100% with how their body is, but I look back now and I think, my goodness, why was I worried? Why was I body conscious in those days when I knew this was if I'd known this was going to happen to me, you know, old age and saggy boobs and wrinkles and all the rest of it, then I would have been much more body conscious when I was young. I wish I could talk to myself then. You know,
I think every woman, you know, I look at myself now and I think, oh my God, wow, you know, how beautiful I look. But then don't you see your daughter doing the same thing? Because I see my daughter doing this, oh, I look fat in this much, and you go, just wait till you look back on pictures of you and realize how beautiful you are.
I always say to Lucy, this is your prime. Enjoy your beautiful body. Enjoy having no cellulite and be able to run along the beach in a bikini with nothing moving, you know, because those days don't last long, do they? No, they really don't. You probably only have 10 or 15 years of being like that, don't you?
Yeah. But you know, now, I mean, you know, the thing is, with all these wonderful treatments like you know, N-Sculpt and, you know, what is it, Coolsculpting, all of those things, they do help us a bit. But I think if you do go to the gym a lot, you'll probably achieve quite good things. I mean, your body is really good, Linda, as much as, listen to our viewers, as much as she's going, like, saggy here and saggy there, if she stood in front of you, you would want to murder her.
Oh, so, no.
Yeah. You look absolutely fantastic. You really do. It's just it's the shame about your personality. That's the only problem with you.
I know. I can't help it. I was just born an absolute cow, and that's the way I've remained. I'm sorry.
Yeah. Terrible, horrible. No, you're gorgeous, darling, inside and out. And that's the nicest thing I'm going to say to you today.
But you know, there's lots you can do, isn't there? If you have the money, you do need to have a bank balance to do these treatments. But earlier in the week we spoke to Dr. Tracy Mountford, who's going to talk to us about some of the treatments that we've had.
And here is the lovely Tracy. Tracy, we need to talk about bodies. What are the new body treatments around?
Well, the new body treatments, I suppose, that hit the press last year, I think, is like Sculpt Neo, which will reduce fat as well as tone muscle. So Sculpt Neo is one. Coolsculpting, I can come back to that, but Coolsculpting is the good old Die Hard that reduces fat, as you know, in key areas of the body really effectively. And I think the one to come into the mix is Morpheus 8.
Really?
that will improve the crepiness and texture on the skin. So they each do different things. So Coolsculpting reduces fat. Sculpt Neo reduces fat and tones muscle. And Morpheus 8 improves texture, lax skin, crepey skin. So Coolsculpting is a long-term permanent solution for fat removal. With Sculpt Neo, which reduces fat and tones muscle, you do get quite significant fat loss there that's pretty sustained, but the muscle toning effect and hypertrophy effect of the muscle lasts far longer than in the gym when you, because I've only got to go away for 2 weeks and not exercise, and I almost feel like I'm back to square one. It lasts much longer than that. It's much more sustained. But I would probably say for most people who have Emsculpt Neo, you probably want to maintain that result once every 6 to 9 months if you can. Some people do get away with once a year.
And it's pretty expensive to do that, isn't it? Really?
It is. And one can't get away from this. The technology is very, funky. And sadly, that means it comes at quite a heavyweight price. Yeah. So, when we can't scoot around this, it is what it is, a course of Emsculpt Neo, and there are not many practices that do it out there at the moment. There's a few, as you know, but not many. You're probably looking, depending on the clinic, at about £3,000 for a course, and that's normally we do 6 for that. But it is pricey, But
it is absolutely fantastic, and I think if you have the mindset that you're going to go straight in the gym after you've done that course and keep it up, then it's absolutely brilliant. But if you're like me and then went back to my old habits, then over time I think I'm still better than I was before.
And I think that probably you wouldn't need to do a full course again to get that reinvigorated, if you like. You'd probably need one blast again, because muscle memory and all of that. And the difference between Emsculpt and working out in the gym, as I've said, is with Emsculpt you're working 100% of the myofibrils in the muscle at any treatment time. With a really effective workout, you're only using something like 30-odd%. You're only targeting about 35%. So it really is much more intense than working out in a gym. But you're right, if you supplement it with just making sure you go to the gym afterwards and maintain it, I think it would give you a longer term investment result.
I felt the first time I had it, I felt like the Incredible Hulk. I had it on my arms and it made me want to go, whoa! I mean, because it makes you feel so, and you are much physically stronger. Works very well on your core. It's kind of weird, but I thought, yes, I can do this. Yeah. She's gone.
But I mean, it was great for me because I'd done nothing for a year and a half, like everybody really. And then I had these courses before I did the long panto season. I don't actually think I'd have got through physically as well as I did if I hadn't had the Emsculpt Neo, because it really gave me that strength in the legs and for dancing and moving around. So, it did do the trick for me, really.
Yeah, it's very good for that strength. And that's probably the thing people notice most, particularly people who do yoga or go to the gym anyway. They notice that they're stronger, they can do more. It improves core very quickly if it's done on the abs. The glutes, of course, are ones that as we age, which I don't think people are always aware of, the thing that makes people sort of posturally poor as they get older or start to stoop or limp is the glutes. The glutes lose their muscle. You lose the muscle mass in your glutes. And the glutes are the biggest muscles in the body, and they act to stabilize as well, together with the core, the lower abs. And once they start to get weak, that's when people get more hip pain, hip postural problems. So actually, Emsculpt Neo is great for medical, as we talk always in these talks about aesthetic, but actually it can really improve core.
It really improved my back, because I had a weak lower back, and from doing the abs and the glutes, it really supported the bone at the bottom of my spine, and I had no back pain at all.
Yeah, it's really interesting, isn't it? Now I find that probably the most interesting thing. And women who have diastasis recti, which is just after pregnancies when their muscles pull apart, it can be used to treat that as well. So it's quite a clever piece of kit, because remember, it came from a therapeutic background, a medical background, and then they happened to see that it worked cosmetically.
But, I mean, most things do, don't they? Most things do come from start from that. So with Coolsculpt, I mean, how long? I mean, I've had it. Actually, I've probably had it about 3 or 4 times. I had it quite a few years ago when it had the great big heads. And now recently I've had the little heads, which are much better, much more comfortable. Yeah. And I think work much better.
Yeah. They hug the body better, don't they, Debbie? They get into, the thing with Coolsculpting is because it was in the marketplace you know, really in the marketplace and well established 10 years ago. And as you know, Magda was
Yeah.
one of the first to ever get her hands on a Coolsculpting device. And of course, like with good technology, it just gets better and they improve and tweak. And so these smaller heads can then wrap around different size bodies and different shapes and different bits. So it's not as basic. It's actually evolved a lot over those years. So yeah, they're more comfortable, but B, they give a better hold on the tissue, and therefore they give a better result. And you know, when you first start to see Coolsculpting results, normally at about 6 weeks, we review at 8 weeks. 8 weeks you really start to see the clinical improvement, but again it tends to get better up to 12 to even 16 weeks. The most important thing about Coolsculpting is this: it's like facial treatment. It's like anything. One has to do enough treatment to see the result. And it is a very, very predictably, you know, generally very predictable outcome with Coolsculpting. It will generally deliver very nice results, but you've got to have enough to see the difference. If people just have, you know, a little bit and a tiny bit and, you know, see how they go, they're not going to get the wow. The most important thing is to have a treatment program. You need this, this, and this done, and then you need to come back and, if necessary, do this and this and finish off, because it's a long-term result and it's not going to go back to the way it was before. It's worth investing in it to get that optimum result and then maintain it. So I always say to anyone who starts Coolsculpting, it doesn't fail often. It generally is very, very, very predictable. Nothing's 100% going to work, not even injections, but it's generally very predictable as long as people do the journey with us. And you've done a few treatments over the course of time.
Is there any, you know, risk of danger with it at all? Are there what could possibly go wrong if anything goes wrong
with Coolsculpting?
Yeah,
I think the only one that's probably hit the press recently, and the one you can't get away from, is when the fat cells, instead of as a reaction, it's not to do with the way the treatment is done or by whom it's done or what's done. It's just your own individual physiology, the way you react to cold. Now, most of the time, fat cells, if they're exposed to freezing, to a particular temperature, they will die. Fat cells will die. That's what Coolsculpting is based on. Very, 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 very rarely, and I want to put this in its place, in some strange physiological reaction in some people, the fat cells swell. So instead of getting smaller, they get bigger, which is, you know, not normal, not the norm. Not normal,
yeah,
not the norm response. And that's something that has hit the press a little bit recently. But again, I want to put this into some form of perspective, which is that is very rare. It is known that it can happen. Nothing, I always say this in medicine to every patient, nothing is risk-free. No. Whether it be surgical, non-surgical. It's about knowing that that's a risk that could happen and taking a view, but it is rare. And generally it's in certain subsections of people, you know, it was generally deemed to be in certain ethnicities, certain areas, certain troops, but it can happen. And that's something that is rare though, but has come to public awareness. But if that happened, which is rare, it can be treated. It can be treated with a traditional liposuction procedure. Right. So, you know, not wonderful. No one's saying, oh, therefore it's okay. Of course we're not. But that is how it can be treated. And I think that with all things, you know, I've been doing, as you know, cosmetic medicine and for many, many years. And it is about knowing that all these things are of the patient's volition. It is a choice. We're not doing this. We are often, they do have very good medical benefits, well-being. I've known people's, you know, well-being to be completely changed, people to, you know, from what they have done. And we treat a lot of medical conditions, as you know. But at the end of the day, you know, this is an elective procedure that's not necessary to save someone's life. So it has to be taken with consideration. But it is a very low risk, Linda. And then other things, minor, you know, with Coolsculpting, you can get bruising. Some people can get bruising. Some people get more long-term swelling than others. The norm is that you're just swollen for a couple of days, a few days, and it goes down again. Some people are swollen for a bit longer. They may swell for more 10 to 14 days. We just have to cover that when we talk to people. But those things are very easy to get around.
So we're in March now, so this would be a great time to be getting it all done, ready to get in your bikini in the summer, wouldn't it?
Timing is crucial here, and I think that, you know, there's nothing worse, and I'm the world's worst on this. I am the worst for this. I will leave everything to the last minute and think, oh no, I haven't had that done, and oh no, you know, I always get my horrible red veins injected about a week before I go on holiday. Well, is that stupid or what? You know, and I'm bruised and I'm marked. So actually, yes, if you plan now, it's the right time to do it, because we think these things have got a lead time, 6 to 8 weeks, 8 weeks, and we want to review, check it's right, check it looks good. And you may need to sort of fine tune and refine. Always do these things.
I've just heard you say about red veins. Can you do red veins then?
Yes, we can either inject them, or we can use the laser treatments we have on them.
I've got one blooming, I don't think it's a varix vein, but it's very blue and it crosses right across the bone on my shin. I'd love to have that injected.
We need to have a look at that, because you may need that, injected by a surgeon. But we can do that at the clinic. But I think
that injected, Deb.
I don't have, my legs are perfect.
Oh,
I don't have any veins on my legs. I don't have any red veins.
I don't even know why you're on this show.
No, I don't either.
No, actually, the more we hear Debbie, the more she's just so perfect. We don't need to.
I wish I'm perfect because of you, Tracy. Or as I used to say, these used to be my tits. That's another story.
So were you happy with your results of your Coolsculpt, Debbie?
Yes, I will show you some. I think we've got some before and after somewhere, and I'll try and dig them up for another show. But yeah, really got rid of my back fat and lots of things. And I really do like the treatment. I also love the lady who did it as well. She was absolutely fantastic, really, really good. So it really has worked on me. And my tummy, you know, here for some reason, just under my bra, this it went sort of like that. I've got this big sort of like.
Quadruple breasts, quadruple boobs. Yeah,
I did, and now I've had that treatment here.
But that's just because your bra wasn't fitting properly. It was hard. It was half.
I have now a line down my chest, you know, where my ribs are and everything. So I look very, very sort of like toned. But Tracy, I need to ask you something. I need to ask you: is there a new treatment for cellulite? Will we ever get rid of bloody cellulite?
I know. Do you know what? As I always say, the day that someone comes out with the answer to that, it's a mega industry. There are machines that do treat cellulite. There's lots that claim to treat cellulite, and the results are slightly questionable, and some of them are really highly interventional. I looked at one where, you know, you almost put a bit like when we were talking about body type, face type in other shows, you know, some of these things involve a needle going out or a blade going under the skin and cutting the fibrous bands, and they're, you know, sort of semi-surgical. And as you know, what cellulite is fat with fibrous bands pulling down on it, so it gets that sort of dimpled appearance, and it's largely genetic. I had cellulite, I suspect, from the day I was born. I mean, I've had cellulite all my life, and it's the bane of women's life. I am the person. I will not go on a beach in a swimming costume anymore. But and I really promote body confidence, whatever size, shape you are. Enjoy your body. I just have a little bit of a hang up about it, and that's my own thing. But the cellulite, we are trialing the Morpheus 8 on cellulite.
Morpheus 8 sounds like it would be doing the right sort of treatment for it, the needles going in and so on.
Yeah, and what we're thinking, I've seen some of the preliminary data on this, and I'm allowed to say this because I can't promote this as a treatment for cellulite because it's not been approved to do that, and it's not been okay to do that. So I just want to say this very transparently in this show. However, I can say what we're feeling and what we're seeing with no promises, and certainly we're going to be trialing it for cellulite because the tissue, the skin is thicker and smoother and firmer. We think we can probably get some quite nice improvements in early cellulite. But wait and watch this space, because we are going to be doing it on, so we have started to trial it on cellulite. I might get my
Are you going to do it on yourself?
Well, do you know what the worst thing is? The worst thing is poor devil, whoever in my clinic has to do my white veiny legs. And I'm also quite, you know, as I said, I'm a little bit self-conscious about it. I mean, not it ruins my life, but I don't want, you know, one of my practitioners sort of looking at my white veiny legs. But I think I would love to, because I think I'd be a very good candidate to see, and I would have a very good eye and know what we're showing. So I think what the honest truth about Morpheus 8 on cellulite is, it's not approved for that. It's not okay, but just wait and watch.
Trust.
Wait and watch and see. Yeah, wait and watch and see.
Oh, well, you're wonderful as always, darling. And we'll see you very soon, obviously.
Yes, come in. And it will be lovely to see you guys, but it's always fun. And I love the fact that we make this, we just open this dialogue up. It's, you know, it may not be for everybody, but it's great to know about it and know what's going on.
At least you know that there are things out there to help you, because before I did this program, I didn't know half of these treatments existed. I really didn't. And the few that I've had great results. They really have, you know, because you always think, oh, they've obviously doctored the pictures, or people they've been paid to say it. Well, we haven't been paid to say it, and I know that Morpheus 8 has made a difference to my face already.
I'll have to come and give you a kiss, Chuchi face, and I'll find
you
out.
will. And I say to Sam, feel my skin, because it just feels much thicker. You know, and it'd be great to have that on your cellulite. I don't mind Matthew looking at my motley.
Will you stop it? You have a husband.
She's back on there again. Yeah,
no, he wouldn't. Listen, he's older. Probably younger than my son. But he was just really gentle. I love all the staff at the Cosmetic Skin Clinic. They're all so lovely. They make you feel really comfortable. They give you all the numbing cream, and they prepare you properly so you know what's going to happen.
I go to the other place, don't I? You see, I go to the other Cosmetic Skin Clinic, the one in London. You go to the one. You go to the one in wherever it is.
Countryside.
She drives around the country.
She does, and I get the one in London. You see, and I have my Magda and all the lovely people there.
Yeah, they're lovely. But I think it's you know, none of these are, as you say, and what I like is that we have to be genuine and authentic about this. You know, our job is to choose the patients carefully so that we're likely to get the best outcomes. For some people, non-surgery isn't the answer. But for others, it really, really is. And it opens up a whole new world for those people and improves their lives in ways that actually, you know, I'm a bit evangelical about it, because it's not just about being self-absorbed and self-obsessed. It's about improving people's lives and adding quality to their lives for those that want it.
Well, thank you, darling Tracy. We will see you soon.
Thank you for having me, girls. See you very soon. Bye.
I just love Tracy. I mean, she's so informative and wonderful.
I know a lot of people think it's a kind of cheat, and that and also it's a lot of money to have these treatments. So, I mean, there is always the gym, and there is always diet.
Did you say gym? Gym?
No, gym. I nearly said J-I-M. No, that's gym.
Yes, I think, as I said to you before, you know, I am so unfamiliar with the gym that I call it James.
James, yes, I know. And I mean, I do work out if I've got something coming up, but I just can't live my life going to the gym every single day or even 3 times a week. I just think you get to a stage in life where you have to accept what your body wants to be. And as I can lose weight and I can diet and I can get myself in a really good shape without any of those machines or interactions with, you know, injections, etc. But I just think life's too short. I want to enjoy just being me and enjoying doing what I want to do.
Exactly. And shapewear is a lot cheaper, and it probably does exactly the same thing. And also you can make yourself look, so I think the minute you have some spray tan on you, or you get the Dove body, anything that makes you browner makes you look much better, I think.
I think it's illusion, isn't it? It's illusion of your arms and legs being darker. They look slimmer.
Yeah.
I mean, the treatments that Tracy's talked about are absolutely amazing, and we've had most of them. But you know, if people out there can't afford it, then there is always the gym and diet. Just be happy with who you are.
Well, obviously, you can't be happy with who you are.
I'm not happy with who I am. I'm not happy with who you are.
No, I think it's very difficult, and I think as a woman, you always want to look better. It's one of your things, and I don't think age. I don't think we need to necessarily say, "Oh, I'm getting older, so I'm giving up." But I do think that these, I never used to use any body creams on my body because my body was all fine. But if you do start using creams on your body, it does actually help with the texture of your skin and with your cellulite as well. So there's lots of things that you can do for yourself, and I think a mixture of both. And if you want to save up for some of these treatments for something special, I think it's really worth it.
Yeah, you're right. You're absolutely right. But I just wish they'd have a nice little pill that you took that dissolved all your cellulite, made you lose about 10 pounds and built up the muscles so you were fit.
So between this time and our next show, we will have invented that, won't we, Linda?
Well, hopefully. Wouldn't it be amazing?
Actually, don't forget to give us any hints and tips that you've got about keeping your body looking good. And we will see you next time. Don't forget to like and subscribe to us on YouTube.
And follow us on Instagram on the.beautyangels. And we'll see you next time.
See you next time. Bye.